Coronavirus cases continue to rise across the United States. According to the Centers for Disease Control and Prevention, the U.S. recorded more than 174,000 cases on Monday. The S&P 500 dropped from an all-time high today as the rising cases trigger fears of more restrictions. Meanwhile, Pfizer's vaccine is starting to ship to distribution centers in anticipation of FDA approving the vaccine for emergency use. But state officials are concerned about the number of doses they're going to receive in this first shipment. Quick Takes Madison Mills has more on the fight for a vaccine. Madison, thank you for joining us. And to start off, tell us the very latest on the vaccine distribution here in the United States.
Right, Renita. So like you mentioned, Pfizer is being very proactive with the way they're preparing for vaccine distribution. They're sending vaccines from their manufacturing centers to these distribution hubs that they've set up across the U.S. But now we're in a standstill. We're waiting for the FDA to vote on the efficacy of the vaccine on Thursday. They are expected to clear the vaccine for emergency use. And at that point, the vaccine will go from these distribution hubs to hospitals for distribution to healthcare workers. Dr. Fauci spoke about distribution earlier today. Let's take a quick listen.
With regard to the distribution of vaccines, as I'm sure you've heard, it's been in the media that the first level, very likely healthcare providers and individuals in nursing homes and other high priority individuals will start getting it in December. As you get into January, February, and March, you will then get the second, third, and fourth level of people who are essential to society, people who are school teachers, people who are children, blah, blah, and on, until you get to what you're referring to, namely the ordinary man and woman in the street, the normal Coloradan or United States citizen or occupant of this country. When can you start getting it available to everyone, and when will everyone be vaccinated? Because those are two separate questions. It likely will be started to get to the vaccine for those who are not in the higher risk categories somewhere in April, middle to end of April. Once you start getting vaccine going, if you have good uptake, namely the overwhelming majority of people want to get vaccinated, you can expeditiously vaccinate people that by the time you get to the mid to the end of the second quarter of 2021, namely May, June, July, August, you very likely could have overwhelming majority of the people vaccinated, which means you'd have herd immunity that would allow you to safely get people back to school in the fall, to safely get people back to the kinds of works that would otherwise be difficult as you get to the middle and end of the summer. So it's going to start in April, and it's going to go right through the end of the second quarter of 2021.
So now the big challenge goes to the states who are having to distribute this vaccine. Earlier today, a spokesperson from the U.S. Department of Health and Human Services told Bloomberg that states like New York and Nevada were prepared for a distribution plan that involved a lot more shots than those states are actually going to receive. And this is a big stat I want to point out here. Pfizer originally said that 20 million doses of the vaccine were going to be available in 2020. Now that number has plummeted to 6.4 million. And again, we're expecting the FDA to clear the Pfizer vaccine for use on Thursday, but there's still no plan for allocation of these shots at the state level.
Maddie, that's a very huge difference when you look at the numbers. How could the change in this data impact vaccine distribution when it comes to a local and global scale?
Right, so one thing that we're hearing a lot about from public health experts this week, Renita, is whether or not those who've already had COVID-19 should be moved to the bottom of the vaccine distribution list. This is a pretty controversial issue here because public health experts really have to be careful. You don't want to tell people that it's a positive thing to get COVID-19. We saw earlier in the pandemic that people were throwing these COVID catching parties to try and get the virus. I remember specifically at the University of Alabama, there were a lot of these events that ended up becoming super spreader events because the attendees wanted to make sure that they had immunity so that they wouldn't have to worry about coronavirus anymore. That's the exact opposite of what public health experts want to happen, right? We want as few cases in the US as possible. So that's why experts are pushing forward this idea of a vaccine-based solution to the surge in coronavirus numbers that we're seeing.
Of course, all eyes are on the vaccine, but are there any treatment developments we should be following right now?
So there's one treatment that came out over the weekend that I am fascinated by. It's this blood test that doctors are testing out right now that basically gives them a footprint as to how your body is going to respond to COVID. They were able to predict 18 of 19 patients who ended up needing ICU beds. They also predicted every single death of a COVID patient who received this blood test. And this is, again, huge as we're seeing this extreme surge in cases because doctors need to be able to plan out allocation of resources of things like ICU beds. So if this blood test does end up doing well in clinical trials, it's going to be rolled out here in the US, and doctors can use that information just to kind of plan out how they can best help patients who are fighting this virus.
Now, Maddie, we're dealing with those rising cases in the U.S. We're also dealing with vaccine shortages here in the U.S. and around the globe. The shots are already getting distributed. Walk us through the latest with those countries.
Right, so over the weekend, Russia started distributing their vaccine, the Sputnik 5, but that vaccine has not really had a lot of transparency around it. We don't know anything about the efficacy of this vaccine, so all eyes are on the UK, which is the first Western nation to develop a big vaccination program. Hospitals are preparing today in the UK for distribution, which is going to start up tomorrow, and it could potentially, if it goes well, be a really great roadmap for countries like the U.S. to follow as we work on distribution of the vaccine as well.
Madison Mills, thank you so much for that report. Now, the logistics of this, Scarlett, will be very delicate to choreograph. You've got temperature to take into account. You've got time to contend with. And what else are you looking at with this?
I'm just still agog that it's called Sputnik 5, the Russian vaccine. I mean, what is our vaccine called? It's not called anything. It's just the COVID vaccine, right?
It's just the COVID vaccine,
Yeah,
and
so
they actually had a name.
That kind of blows my mind, along with people throwing coronavirus parties. Coronavirus is not chickenpox. The two should not be equivalent.
Should not be confused at all.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.